Magandang tanghali Pilipinas. Humarap po ang ating presidente kagabi para sa kanyang regular Talk to the People address. Muling iginiit ng Pangulo na wala nang naiproduce ang Senate Blue Ribbon Committee para patunayan ang akusasyon ng korupsyon. Dagdag pa ni Presidente, ang nangyayaring inquiry ay at the expense of dragging government officials and compromising government's efforts against COVID-19 sa panahon na mataas ang mga kaso at maraming namamatay at nagkakasakit. Panghuli, sinabi ni Pangulo na kung sa tingin ng Senate Blue Ribbon Committee ay may nakakalap na itong sapat na ebidensya ng korupsyon, dalhin ang kanilang kaso sa ombudsman o sa mga korte. Usaping bakuna naman po tayo, mahigit 41 milyon or 41,793,930 total doses na po ang na-administer. Ito po ay as of September 20 at ito po isang ayon sa National COVID-19 Vaccination Dashboard. Sa bilang na ito, nasa 18,823,718 ang fully vaccinated or 24.4%. Sa Metro Manila naman po, nasa 14,873,731 ang total vaccines administered. Sa bilang ito, nasa 6,603,149 ang fully vaccinated or 67.54% na po as of September 19, 2021. Tandaan po natin na walang bayad ang magpabakune. Ulitin natin, lahat ng bakuna ay ligtas at epektibo, anumang brand, dahil lahat ay pumasa sa ating Food and Drug Administration. Dumating po kagabi, September 20, ang 561,600 doses ng Pfizer na donasyon ng US government through the COVAX facility. Maraming salamat po. Pumunta naman po tayo sa update sa COVID-19. Ito po ang ranking ng Pilipinas sa mundo ayon sa Johns Hopkins Worldmeter COVID-19 data at WHO COVID-19 dashboard. Number 18 po ang Pilipinas pagdating sa total cases. Number 14 po tayo pagdating sa active cases. Number 136 po tayo sa mundo pagdating sa cases per 100,000 population. At number 93 po tayo pagdating sa case fatality rate. Nasa 18,937 po ang mga bagong kaso ayon sa September 2021 datos ng DOH. Mataas pa rin po ang ating recovery rate na nasa 91.91%. Meron na po tayong higit sa 2 milyon or 2,171,832 na mga gumaling. Samantala, malungkot po naming binabalita na nasa 36,934 na po ang binawian ng buhay. Nakikiramay po kami, 1.55% po ang ating case fatality rate. Tingnan naman po natin ang confirmed cases by report date around the country. No? Bagaman mataas ang mga kaso, unti-unti na po itong bumababa sa ibang mga lugar. Makikita ito sa Metro Manila na kulay asul na linya. No? Tingnan po natin yung kulay asul. No? Ang mga plus areas ay kulay berde. Ang Mindanao ay kulay orange. Ngunit ang rest of Luzon na kulay pula ay patuloy na tumataas. Sana po ay magpatuloy po ang downward trend. Pagdating sa case trend, nananatilang high ang risk classification sa buong bansa. Tingnan naman po natin ang infographic sa healthcare utilization rate. Sa national and healthcare utilization rate at ICU utilization rate ay nasa high risk. Walang rehiyon ang nasa high risk ang healthcare utilization rate, samantalang 11 rehiyon ang high risk ang kanilang ICU utilization rate. Dito po nagtatapos ang ating presentation. Kasama po natin ngayon si Dr. Edsel Salvania at Dr. Father Nick Austriaco. Puntahan po muna natin si Dr. Salvania. No? Ulitin po natin, Dr. Salvania, ang tanong, are some vaccines better than the others? Talaga naman po ang Pilipino, talagang mas gusto nila ang mga Western brands, pero hindi nga po dumarating. No? Hindi gaya po ng mga Chinese brands. So kayo po ay isang dalubhasa, isang doktor. Are some brands of the vaccine better than the others? Dr. Salvania.
Magandang hapon po, Spokes. Magandang hapon sa lahat ng nakikinig at nanonood. Yung sa ating mga approved vaccines po, yung may EUA na vaccines, lahat po sila ay mabisa laban sa severe disease. More than 90% effective po, pinakita rin sa Centers for Disease Control na it decreases your risk of dying and ending up in the hospital by more than 10 times. Now, ang pinag-uusapan po, ano po ba yung effectiveness nito against yung tinatawag na clinical disease, yung magkakaubo, magkakasipon. Originally, yung nakita po natin sa Sinovac sa Brazil, 50%, pero yung pala, yung variant of concern, nandoon yung gamma, yung medyo matinding variant of concern dati, kaya medyo mababa yung efficacy niya. Pero nung pinag-aralan ito sa Turkey, more than 80% po yung effectiveness niya against clinical disease. Now ngayon yung nakikita naman po natin yung Pfizer na 90 to 95% effective bago pa dumating yung mga variants of concern. Ngayon sa Israel na puro Delta yung nakikita nila, yung clinical efficacy is down to 30 to 40%. So bumababa po talaga yung clinical efficacy ng vaccines pag Delta ang pinag-uusapan, ngunit nananatili na mataas ang effectiveness against severe disease. So the bottom line is po, ngayon, kaya po bumababa, dumadami po yung ating breakthrough infections ay dahil sa Delta. Hindi po dahil nag-wane yung immunity or hindi na gumagana yung vaccines, dahil po ito sa Delta. Pero nananatili po na mataas yung effectiveness ng lahat ng vaccines natin against severe disease, against hospitalization, and against death. So sa ngayon po, any vaccine is good because it will prevent you from dying.
Maraming salamat, Dr. Salvania. Punta naman natin si Dr. Father Nick Austriaco. Dr. Father, malapit na pong mag-70% ang Metro Manila. What can we look forward to pag umabot na po tayo sa 70% o di naman kaya ngayong 65% na po ang bakunado sa Metro Manila?
So thank you for that question, Spokes. First of all, I would like to echo si Doc Edsel's point, because this weekend I was able to calculate the vaccine effectiveness in Davao, because we wanted to see the vaccine effectiveness of the vaccines in the Philippines against Delta in a Filipino context. And it's difficult to do that in the NCR because there's so much mobility between the NCR and Region 3 and Region 4. But we were able to get the data from Davao, and clinical effectiveness for all the mix. So we do not know which specific is currently at 86.5% and 97.5% against death. So it's very important to tell our kababayans that the current vaccines in the Philippines, this is from last month, so this is the August data, is still incredibly powerful at protecting Filipinos against the Delta variant. With regards to the 70%, there's uncertainty because of the Delta variant, but I'm sure Doc Edsel and I will agree what we are looking for is decoupling. We are looking for a decoupling of infection and hospitalization and death. What this means is that if we see that the infections are going up, when the population immunity reaches a certain point, the hospitalizations will not go up, and in fact will go down because the vaccines are protecting our kababayans. And Doc Edsel shared some data with me. There's some suggestion that this may be already starting. It's difficult in the NCR because of the mobility between Region 3 and Region 4A. So it's hard to really focus on the NCR. But we are hopeful that as we achieve 70% and hopefully 80% of total population, we will see significant effects on decoupling.
Maraming salamat, Dr. Father Nick Austriaco. Pumunta na tayo sa ating open forum. Go ahead, Yusek Roque.
Thank you, Secretary Roque. Good afternoon po sa inyo at sa ating mga bisita. Ang unang tanong mula kay Greg Gregorio ng TV5. An article in an online in-depth analysis website says Philippines is facing a fourth wave of COVID-19 infection and is currently the most severe as it is driven by Delta variant. May we get the reaction of Dr. Salvania and Father Austriatico on this?
Go ahead, Dr. Salvania.
Yes po. So we know po, kasi mahirap sabihin kung wave or spike or surge dahil po sabay-sabay yan eh. Ang wave kasi, kung isa lang yung pumasok, tapos makikita mong tataas yan tapos bababa. Yun po yung wave. Ito kasi madaming infections going on at the same time, lalo na yung nai-introduce from outside and also what's in the community. The bottom line is, if we're talking about the number of cases, ito na yung pinaka madaming cases because of the inherent transmissibility of Delta. Pero kung titingnan natin yung number of deaths versus the number of cases, alam natin na more than double na yung number of cases na nakita natin sa Delta for this latest August. Pero dumoble rin ba yung deaths? Actually, hindi. It is just slightly above yung deaths per day na nakita natin nung April. And so alam natin more than double yung cases, pero almost kapantay yung number of deaths compared to April, which means that we are starting to see na even though expected natin na mas deadly nga yung Delta, hindi yun nangyari. And the only thing that's contributing to that most likely, at ito na nga yung sinasabi ni Father Nick na nagsisimula na siguro yung ating decoupling, is yung pagbabakuna natin ng maraming tao. Na instead of naging mas deadly ang Delta, paradoxically, naging less deadly siya if you compare it to the number of cases we have versus the number of actual deaths that we are seeing po.
Opo.
Thank you,
Father
Erica.
Osriaco?
Si Father Esriaco, please.
So I too will agree with Doc Edsel's point. However, it is tragic that I know so many more people who have died in this most recent surge than in the previous waves, the previous surges that we encountered. I think one of the reasons is though the numbers are high, it's also been extended. So it's been the longest surge so far. I think Doc Edsel will agree. We are seeing a downturn in the numbers. If you look at our world in data, it's clear that the surge in the Philippines has peaked. For the last 3 days, we've had negative growth rates in the NCR, suggesting that the NCR also has peaked. But all of these are always reversible, and we have to be very careful as we move into the granular lockdown mode that we do not reverse the gains we have made in the last few weeks.
Opo. I think Secretary Roque may presentation si Father Osriaco.
Yes, go ahead, Father.
That's okay. I think I just explained the data, so I think we'll be fine.
Okay, thank you. Question from Greg Gregorio ng TV5 pa rin for Secretary Roque. How are we going to compare government's responses across these waves?
Well, nandyan po yung world ranking natin. Number 18 pa rin po tayo sa pagdating sa total cases, number 14 sa active cases. Pero ang importante po, number 135 tayo sa cases per 100,000. At ang pinaka-importante, pagdating po sa mortality rate, number 95 po tayo. Dahil 1.55 po tayo, samantalang ang acceptable po ay not acceptable. Pero yung tinatawag nilang more or less average is 2.1 worldwide. So parang napakababa po kung ikukumpara natin sa worldwide trend yung ating mga namamatay. So it says po na bagamat maraming nagkakasakit, nababawasan naman po natin yung mga numero ng mga namamatay. Sana nga po walang umanaw na, pero kung ikukumpara nga po natin sa buong daigdig, mas kakaunti po ang namamatay, ibig sabihin mas magaling po mag-alaga ang ating mga frontliners.
Opo. Ang susunod na tanong mula kay Rosa Licos ng UNTV, kailan tuluyang ititigil ng Pangulo ang government transaction sa Philippine Red Cross? May balak bang totohanin ng punong ehekutibo ang kanyang banta sa gitna ng pandemya? Hindi ba malaki ang naitutulong ng samahan sa pagresponde sa COVID-19? At pag may iba pang kalamidad sa Pilipinas, similar question with Sam Medinilla ng Business Mirror.
Ang hinihingi po ng Presidente, pananagutan, accountability, kaya po pinapa-audit sa COA. Alam niyo po ang ICRC at saka ang mga Red Cross societies, they're bigger than any personality. Yan lang nga po ang epekto kapag ang namumuno ay nasa larangan din ng politika. Kaya nga po siguro talaga dapat pag-isipan na natin ang dapat mamuno ng isang humanitarian organization, dapat po ay wala sa larangan ng politika.
Opo, thank you Secretary Roque. Ang susunod na magtatanong via Zoom ay si Mela Lesmoras ng PTV.
Go ahead, Mela.
Thank you po, Yusek Roque. Hi, Secretary Roque at sa ating mga panauhin. Secretary Roque, unahin ko lang po yung ating kasalukuyang granular lockdown dito sa Metro Manila. Kumusta po yung monitoring ng Malacanang? At may I ask, kasi may ilang residente nagsasabi na hindi pa sila nakakatanggap ng food aid. Do we confirm this? At paano po kaya natin may ensure yung timely distribution, lalo na't ngayong pilot nga ay posible itong ipatupad nationwide?
Now, unang-una po, i-verify ko po kung hindi pa nakakatanggap ng food aid yung iba. Ang alam ko po kasi ito, shared responsibility. No? At ang aking nabalita sa ating mga naunang mga press briefing, on the basis of petsa. At ang unang mamimigay po ng food aid, kung hindi po ako nagkakamali, ay LGU. But I'm sure na nasabi ko na po yan at na-anunsyo na rin po nila yan. No? It will be a joint activity of the LGUs and the national government, pero parang mauna atang LGU. I could be mistaken. I have to check that. No? Pero beyond yung report nga po na may mga ilang area na wala pang food aid na natatanggap, wala na po tayo ibang naririnig na adverse na mga reports tungkol sa granular lockdowns. I will just emphasize po, no, ng alternatibo po na sa ating granular lockdowns ay malawakang lockdowns. Ang ginagawa po natin ngayon ay kung nasaan yung mga kaso, yun na lang po na lockdown natin as small an area as possible. Kaya pati nga po mga barangay, di natin lockdown ng isang buong barangay. No? Kung po pwede, bahay lang o kalye lamang. Kasi ang nais po natin, dahil matagal ko na pong sinasabi ito, bigyan ng pagkakataon na magkapaghanap buhay ang lahat. Dahil hindi naman po pwede na palagi na lang po tayong ayuda dahil ang ayuda po talaga ay hindi magiging sapat.
Opo. And for our health experts lang po, kay Dr. Salvania at kay Father Austriaco, kumusta po yung monitoring nyo dito sa bagong alert level system supplemented by strict granular lockdowns? Sa tingin nyo po ba ito na yung magiging susi para magkaroon tayo ng better Christmas both sa health aspect at sa economic side?
Yeah, I can start siguro. I mean, it's only been a week, but what we've seen naman is ang reports that we're getting on the ground naman mukhang mas acceptable nga sa mga tao. Siyempre, it's always hard pag we're locked in our places. So I'm very hopeful actually na hopefully this is the way forward na we can open up, but at the same time, I echo rin yung sinabi ni Father Nick na huwag po tayo maging complacent kasi these gains that we're seeing now are reversible. Pwedeng umakyat na naman yan ulit kung hindi po talaga tayo mag-iingat. But I think the thrust towards granular lockdowns is really the way forward and we should try to make it work as much as possible.
For me, what I will say is we're doing an experiment. And I'm an experimental biologist, and you do not know what the experiment will yield. There's nothing really comparable elsewhere in the world. So usually if there were we would be able to look at elsewhere in the world to see what they did. But this is a unique approach to the Philippines in the NCR. So we will know within the next 2 weeks whether or not we are able to sustain the gains we've had in the last few weeks.
Okay. At panghuling katanungan na lang po, Secretary Roque, ano po kung kayang schedule ni Pangulong Duterte or ng IATF? May mga dapat po ba tayong aktibidad ng Presidente? Secretary Roque.
The people itong linggong ito.
Sorry, Secretary, okay lang po bang makiulit? Naghang lang po kayo kanina. Yung schedule lang po ng Pangulong Duterte.
Ang alam ko po ay magkakaroon ng pangalawang talk to the people itong linggong ito.
And tama po, tomorrow na yung sa...
Meron po siyang address sa United Nations itong linggong ito.
Okay, thank you so much po, Secretary Roque, at sa ating mga health experts, Yusek Roque.
Salamat po.
Okay, Secretary Roque, ang susunod pong tanong ay mula kay Rosa Licos ng UNTV, kaugnay po ng 2022 national elections. Anong masasabi ng palasyo na pinangangambahan na ng iba na baka raw hindi makaboto ang naka-granular lockdown at magamit ito to declare failure of election?
Well, we will get there po. No? We will answer that situation pag nandoon na po tayo kasi alam naman po ng COMELEC kung anong ibig sabihin ng failure of election. Kung sila po'y naka-lockdown, i-reset lang ng COMELEC ang petsa ng botohan. kung meron pa mga areas under lockdown pagdating po ng 2022. Pero kampante po ako, gaya ng sinabi po ng ating mga dalubhasa, habang dumadami po ang ating mga nababakunahan, pag nagkaroon na po tayo ng population protection or containment, tingin ko naman po makakapagbalik buhay tayo lahat.
Opo. From Joseph Morong ng GMA News, would you have data on hospital admissions broken down into vaccinated and unvaccinated? What does this tell you?
Well, meron lang po tayong datos na pinakita na natin doon po sa mga taga-PGH, yung mga pasyente. No? At lumalabas po talaga doon, yung mga seryosong mga nagkakasakit ay hindi po bakunado. No? I think we released that figure already, no, on the basis of yung admission sa PGH. So ang alam ko po, yung pa lang ang available na datos, no, pagdating doon sa mga vaccinated and unvaccinated. But Father Austriaco, baka may datos, Father.
Yeah, so thank you. So we have some data now from, as I mentioned, from Davao City. I have also received data from several hospitals in the NCR regarding the vaccination status of their healthcare workers, and we are calculating the vaccine effectiveness of these different vaccines in the NCR for the healthcare workers. So hopefully this data will be able to help us to understand how often they get sick and how strong the protection is. But one of the things I point out, is that the data from Davao suggests that we don't need boosters for the general population yet. I know a lot of Filipinos are wondering whether or not they should start receiving boosters. If the effectiveness is 86%, as the data seems to suggest in Davao, in the general population, it suggests that we don't need that, which is why we need the data for healthcare workers to see whether or not they need boosters, as other countries are beginning to deliver those as well.
Maraming salamat, Father Austriaco. Go, Yusek Roque.
Yes, ang susunod pong tanong mula pa rin kay Joseph Morong ng GMA News, is there still vaccine hesitancy? Where do you attribute this?
Well, ang pinagbabatayan po natin ang mga survey, no? And we have to admit na malaki pa rin porsyento ng nagkakaroon ng hesitancy, at ang pangunahing dahilan pa rin ay yung kanilang pagduda doon sa safety at efficacy. Paulit-ulit naman po natin sinasabi, hindi lang po Philippine FDA ang nagsasabi na ligtas at gumagana po mga bakuna, pati na po ang WHO. At kakagaling ko nga lang po sa New York. No? Sa New York po, nakakapagbukas na ang kanilang ekonomiya dahil ang rini-require po nila ay yung mga vaccine cards. At ang New York po ay 80% na po silang vaccinated. Napakaganda na po ng lagay ng ekonomiya doon, at sana po umabot din tayo sa punto na 80% mababakunahan na mabuksan na po natin ang mga hanap buhay para sa ating mga kababayan.
Okay. Thank you, Secretary Roque.
Yeah, Dr. Salvania.
Yes po. I-add ko lang, Spokes, yung data that FDA has released as of August 29, out of 13.87 million fully vaccinated individuals, ang number of breakthrough cases ay 242 only. This is the majority of this is Sinovac. And so that's 0.0017% breakthrough infection. Of course, over time, makikita natin mas dadami yung breakthrough, but that is a fantastic number. So that really tells us that our vaccines are working po.
Thank you, Dr. Salvania. Yusek Roque?
Opo. Ang Secretary Roque susunod na magtatanong via Zoom, Trisha Terada ng CNN Philippines.
Go ahead, Trish.
Folks, and to our guests po. Sir, first of all, dun lang po sa allegation ng false positive test results by the Philippine Red Cross. Saan po nakuha ng Pangulo yung figures that he mentioned, like 44 hospital workers, yung sa PSG and yung sa DOF, where he alleged false positive cases? And kailan pa po niya ito nalaman?
Actual figures po yan, no, as reported, kasi matapos mag-test ng positive, right away nagkaroon ng confirmatory test, lahat po sila, yung porsyento nga po na sinabi ni Presidente yung nag-negative. Yung second instance naman po, yung 200 plus, lahat po yan PSG. So kumbaga, within the family po yung datos na yon. No? So linabas lang ng Presidente yon kasi dapat talaga maimbestigahan ng RTVM paano nangyayari yan.
actual figures coming from where? Specifically, yung PSG, sir, kasi parang we can say, okay, he got it from the PSG. But pero yung mga unnamed healthcare workers and yung sa DOF po, saan po nanggaling? Saan nagsistem po yung mga data na yun?
I think isang grupo rin ang nagpa-test niyan eh. At sabay-sabay sila nagpa-test at yan nga po naging resulta.
Mm-hmm. And did the President independently verify it? And hindi po ba nangangamba yung Pangulo or even the Palace na ito po baka mag-cause ng takot or doubt sa number ng cases natin? And that his question is actually kumbaga raising doubts over the actual number of COVID cases, yung data po ng DOH.
Kaya nga po kinakailangan maimbestigahan kaagad yan ng RTVM. Nasa makina po yan eh. So you have to test the accuracy of the machines. At yan po ay ginagawa na as we speak.
Mm-hmm. And sir, kung itong mga data na to dati pa naging available, bakit po hindi pinatigil and in-investigate? Bakit hindi po ba reflective to ng kumbaga incompetence sa part ng DOH? Kasi parang hindi po nila monitor yung mga labs all this time. Then what gives us the assurance that all other labs are giving us credible results as well?
Well, hindi ko lang alam kung kailan talaga ito nangyari, no? Pero I think it happened fairly recent at kaya nga po ngayon nagkakaroon ng investigasyon.
Mm-hmm. Pero sir, ano sa tingin ninyo yung magiging impact nito sa testing natin? Kasi diba sir, ngayon, ang problem po natin, meron pa rin talaga kasing cases, for example, in the provinces, may mga taong hindi pa rin po talaga naniniwala or in denial, halimbawa nag-positive sila. Hindi ba sir parang mas ma-feed lang yung doubt nila na kapag nag-positive sila, isipin nila, baka negative naman pala ako. So, kumbaga sir, hindi ba magugulo yung paniniwala ng tao or yung magiging response nila kapag nag-positive talaga sila?
Hindi, Trish. Kaya nga pinapaimbestigahan natin para we will make sure that the tests are in fact accurate. Now we know they're not perfect, but we are taking steps to make them more accurate.
Mm-hmm. Sir, ito na po yung sa kay Davao City Mayor Inday Sara Duterte. No? They informed the IATF of the low acceptability ng Sinovac and Sinopharm vaccines from China. And kumbaga, they're also urging, or at least they're asking the IATF to at least consider buying more Western vaccine brands instead of these Chinese vaccine brands para kasi doon po mas kumpiyansa yung mga tao.
Well, on behalf of IATF, sino bang ayaw ng Western brand? Ang problema lang, talagang di natin nakukuha ang supply. We ordered 40 million, pero nakikita nyo naman, they come in trickles. No? Ang dumarating pa, mga COVAX supplied, no? Yung mga donated. Pero yung mga binibili natin, talagang they've been coming in trickles. Pero I guess I will also ask Father Austriaco because may data nga siya from Davao. So ang importante, Father, from the data you've seen, totoo ba ho na less effective ang Sinovac sa Davao? Just for the record.
Well, we don't know the exact mix of vaccine brands in Davao. So we cannot do the calculations for Sinovac versus one of the other brands. All we can say is that the given mix, the current mix of vaccines that have been deployed in Davao are effective. And most of them are Sinovac. We just don't know exactly how much.
Mm-hmm. Okay, thank you, Father. Sir, just one last bilis lang po. So, ibig sabihin ba nito, sir, the President is questioning the integrity now of, doon ba din sa Red Cross, sir, no? Questioning the integrity of our COVID-19 testing data reporting. And bukod sa Red Cross, sir, is the President also open to ordering the DOH to investigate or look into the processes of other laboratories?
I think that's a wrong conclusion. I think the President wants our testing to be more accurate.
Mm-hmm. Pero sir, ipapatest niya rin po ba yung, or papasilip niya rin po ba yung ibang laboratories?
Well, I think that is the offshoot of the President's order that RTVM, dahil medyo matagal-tagal lang ginagamit ang mga makinang yan, no, must really go out of its way and test the accuracy, miski at a random basis, yung mga makinang ginagamit natin ngayon.
Alright, thank you very much, Spokes.
Maraming salamat, Trish. Balik tayo kay Yusek Roque.
Yes, Secretary. Mula lang kay Joseph Morong ng GMA News, how do you address an issue na maraming gusto magpabakuna pero wala namang available? Iba ang tagal magkaroon ng sked in Cavite, for example. Supply seems to be a problem there.
Well, maraming salamat po sa inyong pasensya pero ngayong linggong po ito, report nga ni Secretary Galvez na pinakamaraming dumating na supply natin itong nakalipas na linggo sa ating kasaysayan, no, ng pagtatanggap ng mga bakuna. So naroriyan na po ang mas malaking bulto na ating mga bakuna. So parating na po sa inyo. At salamat po sa inyong pasensya.
Opo. Tanong ni Laila Salaveria ng Inquirer at natanong na po ni Trisha Terada about Davao City Mayor Sara Duterte yung proposal sa buying more Western vaccine brands. Similar question po yan with Celerina Monte ng NHK, si Joyce Balanzo ng ABS-CBN. Ang second question po ni Laila Salaveria, what will it do about the mayor's concern that there is low acceptability of Chinese brands in Davao City?
Well, nandito po si Dr. Salvania at saka si Dr. Austriaco to assure people na so far po ang datos ay nagpapakita gumagana po ang lahat ng ginagapin nating mga bakuna.
Opo. Tanong naman mula kay Salarina Monte ng NHK, there's a likelihood that other LGUs may also request the same. If so, what will happen to Sinovac vaccines considering that the government has already ordered bulk of Philippine vaccines from Sinovac?
I will ask our experts to respond, pero ulitin ko lang po yung sinabi ko. Lahat po tayo may preference. Pero gustuhin man natin ang mga Western brands, hindi po talaga dumarating. And the Philippines is not alone. Kaya nga po doon sa kampanya ko sa International Law Commission, ang sinasabi ko dapat may tratado na kikilalanin ng mga bansa sa buong daigdig, yung vaccine equality, no? Na dapat lahat magkaroon ng bakuna. Pero hindi pa po yan nangyayari. So sa ngayon po, lahat po ng pag-aaral ay nagpapakita na pati po ang Sinovac, ang mga Chinese vaccines, ay epektibo po laban sa seryosong pagkakasakit at laban po sa kamatayan na dulot ng COVID-19. But siguro po, to address these points, let the experts talk. Alam ko po, nakapagsalita na sila, pero mas importante pong marinig ng taong bayan galing sa mga dalubhasa ang kasagutan dito. Go ahead, Dr. Salvania.
Thank you po, Spokes. Unang-una, ang Sinovac at Sinopharm po ay merong WHO emergency use listing. Ibig sabihin po nun, nakita na ng WHO na mabisa at effective itong mabisa at ligtas ng mga vaccines na ito. Pangalawa po, we've given more than 18 million doses of Sinovac in the Philippines. And nakita naman natin yung data na pinakita na sinabi ni Father Nick na 86% or more. And so more than half of those will be Sinovac. And finally, yung sa 242 breakthrough infections out of 13.7 million fully vaccinated individuals, those numbers, like I said, are fantastic. I have no doubt that Sinovac, Sinopharm, Pfizer, Moderna, all these vaccines continue to protect against severe disease. And wag po tayong mabahala. Mas importante po na maprotektahan natin against severe disease ang ating mga kababayan kesa yung maghihintay tayo tapos tamaan na tayo ng COVID, pwede pa tayong mamatay. So it's very, very important that we take what vaccine is offered so that we get protection as soon as possible. Otherwise, we put our lives at risk and we will prolong this pandemic po.
And Father Dr. Niconar Astrioco, at the risk of paulit-ulit, pero kinakailangan po paalalahanin uli ang ating mga kababayan.
Any vaccine is better than no vaccine. And all the vaccines will protect you and protect us from severe disease and from death. And we do it out of love of our families, right? Because if you get sick, your family will be at risk. They will lose you. They will lose you forever. So it's better to go and get vaccinated now because there is no promise you will get Pfizer and Moderna, especially since the United States is about to start a booster program for Pfizer and Moderna, and we do not know how that will impact the worldwide supply of Pfizer and Moderna. We hope it will not, but we've seen before the US will start buying hundreds of millions again. This will put an immense pressure on the world supply. So go and get vaccinated now.
Maraming salamat, Dr. Salvania and Dr. Austriaco. Balik tayo kay Yusek Roque.
Yes, thank you, Secretary Roque from Red Mendoza ng Manila Times. Ano po ang masasabi ninyo sa enforcement ng mga bakuna bubble? Sa tingin nyo ba gagana ito kahit na hanggang sa ngayon tumataas pa rin ang mga kaso?
Well, hindi pa naman po natin pinapatupad ang mga bakuna bubble. No? Pinag-aaralan pa po yan. No? At ngayon po sa ating mga dine-in, no? 10% lang pong inaalaw para sa mga fully vaccinated. No? Sa akin naman po, at some point, kinakailangan magkaroon tayo ng tiwala sa mga bakuna, pero sa ngayon po, hindi pa po natin napapa-implement po yan.
Opo. Second question niya, nagkaroon po ng mainitang diskusyon ng FDA ng Amerika tungkol sa pagbibigay ng booster doses sa lahat ng kanilang mga citizen doon na nauwi sa rekomendasyon na dapat 65 up at mga vulnerable lang ang pwedeng bigyan ng booster. Ano po ang posible na possible implication nito sa ating bansa?
Well, napakahirap naman na baliwalain ang naging finding ng US FDA kasi ito po yung kinikilalang FDA na napakataas ng kanilang standards. At kung kanilang desisyon ay hindi magbigay ng booster sa lahat, no? Kung hindi doon sa mga sa A2 population natin at saka A3 population, so be it. So I don't know if our experts would like to add, Dr. Silvania, Dr. Astriaco.
Yeah, ang add ko lang kasi unang-una, wala pa naman tayo sa 6 months dito sa Pilipinas eh. Actually, ako number 2 akong nakakuha and Sinovac. So, itong mga breakthroughs na nakikita natin, this is not waning vaccine. Ang nangyayari dito is Delta. Yung Delta talaga ang nagbe-breakthrough dahil Delta siya. Nakita rin naman natin kahit sa Israel, 30 to 40% na lang yung efficacy ng breakthrough sa Delta. Although yun nga, tuloy yung protection against severe disease. So sa ngayon, hindi pa ako kumbinsido na a booster using the old vaccines will work kasi you make the same old antibodies, hindi sila masyadong maganda gumana sa Delta. Bagamat may ginagawa na ngayon na clinical trials sa reformulated vaccines specific to the variants of concern, kasama po yung Delta, and I think those might be more appropriate later on. Pero as for booster ngayon, ang ginagawa kasi ng FDA, yung third dose na yon, hindi po tinuturing yun na booster. Actually, third dose po yun kasi sa mga mas matatanda, sa mga immunocompromised, yung first 2 doses might not take. And so a third dose might help them get fully vaccinated. Pero dun sa general population, mukhang for now, 2 doses is enough. At kung magkaka-booster man tayo later on, I would rather get a new and improved reformulated vaccine na kasama na yung Delta sa titirahin niya. Dahil kung mag-boost tayo nitong old type vaccine, I don't know how much more it will add sa clinical efficacy, and mataas na rin yung protection against severe disease. So hindi na yun makaka-add rin ng masyado. Mas importante gamitin natin tong old vaccines na to vaccinate people who have not yet been vaccinated dahil mas malaki po talaga yung benefit doon.
Dr. Astriaco?
I agree. At this point, it's so important to build up population immunity in the Philippines. And the population immunity will also indirectly benefit those who are immunocompromised and who might have weakened immune systems because it prevents the virus from getting to them. And so at this point, I mean, here in the United States, the FDA expert panel spoke up against the president of the United States because President Biden wanted to extend this to the general population, but the expert panel said that there is no evidence, secure evidence to support this beyond senior citizens and those who are at risk for severe disease. And the question now is whether or not this includes healthcare workers who are at risk simply because they are exposed to high viral loads of Delta.
Thank you very much, Dr. Silvania and Dr. Austriaco. Back to you, Roque, please.
Opo, yung third question po niya, consistent ang less than 3% ng moderate, severe, and critical cases kahit pumapalo ang kaso natin ng 20,000 plus. Do you think may epekto na ba ang mga bakuna?
Well, from a layman's point of view, mahigit 65% na po sa Metro Manila, baka naman po meron, but I will ask the experts to answer. Dr. Silvania?
Yes, folks. Actually, we've been looking at this. Siguro mga 3-4 weeks ago, ang proportion natin ng severe plus critical was about 2.8%. Nowadays, it's anywhere from 1.5 to 2.1%. So alam naman natin na we were expecting Delta to have more severe. So imbis na tumaas or stay at 2.8%, bumaba pa. And there's really only one explanation for that, and that's really the vaccination. The other thing is, kung titingnan natin yung by region na mortality rate or yung case fatality rate, ang NCR is now down to about 1.2%. And so I think, of course, early pa rin kasi yung fully vaccine, yung umabot tayo sa 50% is just a few weeks. So it's very difficult to make hard conclusions at this point. But from what we expected versus what's actually happening, even yung projected cases for Delta by September 30 was at conservative 150,000 active cases in Metro Manila. Nasa September 21 na tayo, we're at about 50,000 cases na active. So that's almost 100,000, that's more than 100,000 below expectations. So I think dito na natin nasisimulang makita yung epekto nitong enhanced vaccination program. And of course, yung ating mayors rin have really shortened the time to detection. Yung sinabi, yung recommend nga ng faster na we have to do our PDITR more aggressively. Mukhang ginawa naman po talaga nila. So I think that what we are doing is working right now. But of course, the hospitals are still full kasi ang dami talagang kaso. Kagaya ng sinabi ni Father Nick. As this goes down, we really have to reinforce our healthcare system and at the same time, continue our vaccination program po.
Thank you, Dr. Silvania. Dr. Sriaco?
I'm still waiting for the data. I think that there's two things I'm waiting for. First of all, the vaccinations take 2 weeks after the second dose, number one. And then the severe cases and death is always 2 to 3 to 4 weeks after infection. So there's still significant lag. So I'm still waiting for data to decide exactly what is happening.
Thank you, Dr. Sriaco. Back to you, Sec. Roque.
Yes, Secretary. From Samuel Danilla ng Business Mirror, may update na kaya sa response ng COA sa appeal ni President Duterte to audit Philippine Red Cross?
No response yet as far as I know.
From Lay Alvis ng GMA News, following Pfizer's announcement that their vaccine also works for children 5 to 11 years old, do you think the Philippines should also start vaccinating children? For Dr. Salvania and Father Austriaco.
Yeah, I think at this point, it's important to stick to our prioritization program kasi alam naman natin ang A1, A2, A3 are at the highest risk for dying, followed by yung population na 20 to 59 years old na alam naman natin ang baseline risk of dying from COVID can be as high as 1%. At kung i-vaccinate natin, it goes down to 0.1%. Yung children 20 years old and below kasi, yung baseline risk nila of dying is about 0.1%. So, bagamat we want to get that down to 0.01%, mas importante po na i-target natin yung mga at higher risk for dying. Once our supply is okay, then we should vaccinate everyone po.
Father Sriaco?
I too would like to wait. And also, it's interesting, in my view, and this is, I'm not a medical doctor, but in my view, given the technology, if we were to vaccinate, especially our very young, I think it would be important to err on the side of Sinovac rather than a Pfizer or Moderna, because the technology for Sinovac is so much more understood. And our young children, especially those who are still prepubescent, we're not quite sure what will happen, right? So I think, just like Dr. Edsel, I think there's no immediate need. And but personally, if you ask me as a molecular biologist, if given the risk is already so low for a young child, if we had the option of if an mRNA vaccine or an attenuated vaccine, I would err on the attenuated vaccine to lower that 0.1 to even lower and minimize any risk long term for the development of our children.
Maraming salamat, Dr. Austriaco. Yusek Roque?
Yes, Secretary Roque, from Chris Jose na Remate Online, reaksyon po sa sinabi ni Vice President Lenny na iwasan daw po ang mga personal na insulto sa isinasagawang Senate inquiry ukol sa overprice sa pagbili ng medical supplies at sa halip ay manatili lang sa katotohanan, lalo na raw po ngayon at nahaharap pa rin sa pandemya ang bansa.
Agree po tayo, pero lumalabas po na parang yung ilang mga senador hindi papayag hanggang hindi lumabas na di umano ay may korupsyon. Malinaw naman po, walang overprice sa PPE, walang overprice pagdating sa face mask. Sumunod po sa proseso kasi ang Bayanihan 1 sinabi hindi na kinakailangan sumunod doon sa 9184. So hindi ko po alam kung ano pang gustong makuha ng mga senador dyan sa pagdinig na yan. No? Pero kung ikukumpira po natin doon sa pagdinig sa Kamara de Representante na hinahayaang sumagot ang mga testigo at mga resource persons, lumalabas po talaga, wala pong irregular doon sa mga biniling mga PPEs, face shields. At saka siyempre po, nandyan yung testimonya mismo ng chairman ng COA. So sa tingin ko po, kung sinabi na ng COA na walang overpricing, hindi ko po alam kung bakit pa nagpapatulog. Kung hindi, politika na lang talaga ang dahilan.
Opo. Second question po niya, hindi man po niya pinangalanan ng Pangulo ang Pangulo, pero batid naman po ng lahat na madalas na pong pinapatutsadahan ni Pangulong Duterte si Senator Gordon gaya ng pagiging mataba nito, pinuna rin ng Pangulo ang hairdo po ng senador.
Hindi ko po alam kung anong tanong.
Okay.
Wala pong tanong.
Okay. Mula po kay Kylie Atienza ng Business World, the Makati Business Club is urging the government to improve its virus containment efforts as the economy reopens. Ano po ang mga paghahanda ng gobyerno to prevent a potential virus contagion? Are we prepared enough for the reopening of the economy?
Well, unang-unang po, nagpapilot nga po tayo ng combination ng granular lockdown na napaka-stricto nang po pwedeng lumabas lang effectively ay ang mga health workers at mga OFWs at saka combined with yung alert systems. So ito po ay ginagawa natin dahil naintindihan po natin na kinakailangan magkaroon na ng hanap buhay ang nakakarami sa atin. So hinihingi ko po ang kooperasyon ng lahat dahil kung ito po ay maging tagumpay, napakalaki po ng porsyento po pwede na makapaghanap buhay. Importante po yan na makapagbalik buhay tayo.
Okay, thank you Secretary Roque.
Maraming salamat. Yusek Roque, maraming salamat. Dr. Salvania and Father Dr. Austriaco, maraming salamat sa lahat ng ating mga naging kasama dito ngayon sa Malacanang Press Corps. Sa ngalan po ng inyong Presidente, ito po ang inyong spokes, Harry Roque, nagsasabi, Pilipinas, may katapusan po ang lahat. Kung tayo po'y umabot na sa 65% na nabakunahan sa Metro Manila, malapit na po ang ating inaasam na containment at pagbalik buhay para sa lahat. Magandang hapon po, Pilipinas.